This panel will offer some reflections on this topic in the context of what we have heard earlier in the day, followed by what we hope will be a thoughtful and very robust discussion from all in the audience. It'll be moderated by our long-term colleague, Rima Rudd, who is the Senior Lecturer on Health Literacy, Education, and Policy at the Harvard T.H. Chan School of Public Health. Rima's work reflects all that she's done on communication, health communication, design, and evaluation of public health community-based programs. She's been teaching courses on innovative strategies in health education, program planning and evaluation, psychosocial and behavioral theory, and health literacy since 1988. Dr. Rudd focuses her research inquiries and policy work on literacy-related disparities and literacy-related barriers to health programs, services, and care. She works closely with the adult education, public health, oral health, and medical sectors. She has served 2 terms on the Roundtable on Health Literacy, and thank you very much, Rima, for that and all you've taught us. She has received national and international awards for her work in health literacy. Most recently, the University of Maryland named a Doctoral Scholars Award in her honor. Rima, for you.
I'm really delighted to be here, and we have no slides. This is a panel that's really going to focus on reflections. Reflections from our work and reflections from the day. And then we invite you for the next half of the session to really offer reflections of your own and ask questions of the panelists and of others as well. So let me just begin with a very brief introduction. We know, and we know this well, what the literacy skills are of older adults in our society. And we know that the literacy and numeracy skills of older adults in all industrialized nations, mind you, are lower than those of working adults. We know that there are health consequences to limited literacy, and we've documented them very well in terms of health promotion, disease prevention, healthcare management, disease management, decision-making, and so forth. And we researchers, practitioners, policymakers know a lot about elders as well. We know about the multiple physical, social, emotional, cognitive changes that take place with aging. However, what we don't know quite as well and what we haven't researched quite as well, that has been illuminated in part here today, is the fact that we've not been as attentive to the shifting landscapes, the physical and social and normative environments that we, as older adults, are expected to navigate. New territories, new languages, new decisions, new devices, new technologies. This morning, Marianne Zimmerman, Stephen Thomas certainly set the stage by highlighting the unnecessarily complex demands of the flawed systems that we live with. In planning today's workshop, the planning group used the metaphor of multiple landscapes to shape our discussion. So we highlighted the personal landscape, the landscape of the family, of the community, of health institutions. And in so doing, we really wanted to draw attention to how health literacy could enhance the experience of older adults as we navigate not only the pathways within health institutions and health services, but also the social normative structures that influence our everyday lives, that influence how and where we live, how and where we die, our interactions with others and with other institutions, what the silences are, what we're expected to keep silent about and what we're expected to talk about. And we have to figure out how health literacy can enhance, can modify, can change these structures so that the road becomes easier to navigate. That's the issue. We're not necessarily focused on how we change the older adult. And how we enhance the skills of the older adult, although that's important. That's not to be dismissed. But the emphasis here is really on how we keep our eye on the journey, how we keep our eye on the terrain, how we keep our eye on the environment, and what we can do to make modifications to make this journey a little bit more pleasant, a little easier, something that is more joyous to navigate in some ways. And so I'm really delighted to introduce you, although you've met one or two, to 4 people who have very different backgrounds and very different experiences to really shape their perspective. And they will offer some insights that they've garnered from their work, from their experience. So I'm just going to go, I think, in alphabetical order. I'm going to start with Colette Edwards, who is a strategic thinker, as well as an internist and gastroenterologist, mind you, who is really focused on ways to optimize the health and well-being of her organization, Humana's 45,000 associates and workers. Susan Goodman, who has worked almost all of her career focusing on supports for older people, but has decided strategically that stories are incredibly important. And she began a blog, Acting Our Age, Women's Lives at 85 and Plus, to really deep down to capture the stories and the insights from others. Yolanda Brignoni Taylor is with AARP. She too is a strategic thinker. She's the Strategic Communications Director for Health and Healthy Living. And her focus of her work is to really organize and deliver effective health communication for the organization. Our last panelist is someone you've already met, Marianne Zimmerman, who clearly in her presentation has used her engineering skills and the logic behind engineering to develop insight that helped her shape organizations not only of her own health and well-being, but of those of others in looking at healthy living and healthy communities. So I'm going to ask each of our panelists to, in a sense, address, not necessarily answer, but address a series of 3 short questions. And people cannot take very much time, but we'll have a lot of time to explore their insights, through your questions afterwards.